Oh,
Cool.
okay.
Yeah,
All right.
yeah,
We're
that's called operator malfunction.
well,
We're good at that.
All right,
Okay.
you guys go ahead. I'll just start recording.
Okay. Hi, Doc. Hey, thanks for the x-rays.
Oh, sure.
Okay, cool. Well, I mean, on the bending films, it shows pretty clear there's 4 discs that aren't working right. I mean, you got the L5S1, L4, L5 on the left, you got L2, L3, and L3, L4 on the right. And so, Doc, do you do any flexion distraction at all?
Yes.
Ah, totally cool. Yeah, yeah. So he's going to recover quick. Do you do post X-rays?
Yes.
Oh my God, fantastic! What part of the world are you in?
It's right outside of Pittsburgh.
Cool, man. I'm going to keep your information. We're building a website for corrective chiropractors, and you're a rare animal to find.
That's what I hear. I can't believe it, but I've had other people tell me. I've had a couple other people that listen to you that are followers of your channel that have, like, called. They said they've called 10 chiropractors before they found us.
Yep. Yeah, you got to have somebody that has a technique sufficient to work beyond the symptoms, and utilizing an objective analysis is like basic.
Right.
You're getting work done.
Right.
Okay, so now, do you guys have any questions?
no, just waiting. I'm figuring we sent you the X-rays, just waiting to see what you have to say.
Okay, well, when on the bending films, when you bend, it should open up, like if you're bending off to the side, the outside portion of the curve, you should have wide discs on the outside, narrow discs on the inside. On your bending films, you're showing abhorrent bending where you're bending this side, but you got a couple of discs that are bending in the opposite direction. And so on the right bending, you'll see L3 and L4 and L2 and L3 on the right aren't working correctly. So that would be, abnormal dysfunction. And when they say like slip disc, bulging disc, herniated disc, none of that stuff's accurate. Okay, they're not slip, bulging, or herniated. What they are is it's a combination of trauma to the disc, increased tone to the muscles to protect the nerves, and then that causes the disc to lose nutrients because discs get their nutrients through movement or imbibition. And so this is a combination of proprioception, or your brain's view of how those muscles work and how the body is, and trauma. So if you say they're just not working correctly, that's the most accurate statement that you can have. Now on the AP, lumbar and pelvis, and by the way you took the x-rays were perfect. You never see a nasium view like that.
That was a tricky one. We haven't used that one in a while.
Oh my God, buddy, it's so clear for the patients, because the patients, if they just see a spot shot, they can't really correlate it in their brain, most people, about where it is in the body. And then we've got, because we do digital, and we've got this knitting software that will put the nasium view on top of the AP lumbar pelvis view. And seeing that AP lumbar pelvis view, it's really friggin' clear.
All right.
And you can see there's a little mid-thoracic, issue too. Now there's at a CBP, the aligned spine, there's a posture analysis that I think it's only like $100 program, or it's almost a free app, where you can do a digital posture analysis, and with the forward head carriage that he's got, that there may be a hyperkyphosis as well. And so the forward head carriage and hyperkyphosis is contributing to the low back issue as well.
Right.
Yeah. So this is going to be ideal. And I mean, lateral flexion, distraction with lateral flexion. And what we'll do on the discs, we'll do a thumb contact just lateral to the paravertebrals, and we'll do a vibration at 10 cycles a second. And I just got to convert a jigsaw. where, you know, I just put a rubber furniture in on the end. So it does a pretty significant impulse at about 10 cycles a second to relax the disc and allow the disc to change that proprioceptive firing. And what we'll do, we'll distract, laterally flex, until you feel a change of tone of those muscles, which means you've actually altered the joint mechanoreceptors and the intrinsic muscles. All of those things are doing that proprioceptive influence. So once those have changed, then we'll do a drop. And so this is when the patient's laying down, okay, or in the prone position. Then we'll put them in side posture without any torquing or rotation, more like a Gonstead move, where, because the more you torque that body, you know how a lot of people, they'll switch the thoracic area and then twist the hip around to try and lock out the joint? Well, and Gonstead found, and also too, when you look at the Carrick neurology stuff, the more you twist that spine, the more you're initiating those joint mechanoreceptors, and then the postural muscles that you don't have conscious control over increase in tone. And then any influence you do into the body, it's not gonna be positively affecting it. So we'll leave the spine in a completely neutral position and contact over L3, L4, and 203 on the right. So the right side will be up, and then flip them over, and then do the L4, L5, and L5S1 on the left. And we'll do a drop on a side posture 2, 3, 4, 5 times until we feel a change in the tone of the muscles. And then we'll lay them in the supine position and do the same thing, but we'll do an A to P lumbar with lateral flexion. So I'll be supporting their head, lifting them up, radically bend them over, and do a drop. So think of this. This is the cool part. We're influencing the body or proprioceptive response when the person's in the prone position. Side posture, their brain's in a different proprioceptive attitude, but we're doing the same force loading. And then they're in the supine position, and we're doing the same force loading. So the brain is in 3 different attitudes while they're getting the same force loading in there, radically altering proprioception. Radical. And then for an exercise, here, let me find out. Here, one sec. Cool. Yeah, this is one of the exercises that we use. It's a foam block and 4 inches in diameter, and I'm pressing really hard, and it's almost not compressible. And this will be placed as an exercise to convert sitting into therapy. Because, I mean, you get office workers or people that have a sedentary lifestyle, and how this is placed is, Shiva, can I borrow you a second? Yeah. Okay, just face that way. No, come over here so I can show you.
Hi.
So, hi, here's my model. Okay, so the bottom of the elbow is where the bottom of the roll goes. And it's placed horizontal right there. So it's right at the thoracolumbar junction. Excellent job. Thank you. Yeah, do you guys have models just walking around that you could use?
Not as lucky.
Okay, I just wondering. Oh, here, you got it better. Here's another. Bend your arm 90 degrees. The bottom, no, not like that. Okay, so just like that. You cheesecake.
I know.
Yeah, he's stuck with me.
Well, aside from a lack of hair, you're an attractive man. Yeah, and so that, and then we'll prescribe this, and now this is the tough part. These things, I haven't found anything better, but they're $15 for a 4-foot length, and we cut them in about 8 inches, so we get 6 of them out of a so they're expensive for just a device, but I haven't found anything that works better. You can use a water bottle, but that's too uncomfortable and not convenient. And then it's placed back there 20 minutes in, 10 minutes out. So this way, since human tissue at 20 minutes of consistent force loading, the plastic elastic deformation curve happens. And then to explain that in English, if I put this material under a force load and let go, it retains its original shape. However, if I put this under a given force load for a long enough time, it retains the new shape. Okay, and that's called the plastic or elastic deformation. Goes back to the original one. Plastic deformation is when it holds in the new positioning, and that occurs in human tissue at 18 minutes. And this is why every time you hear these BS exercise videos, yep, only 20 minutes a day, you can get this, you know, because they're utilizing the plastic elastic deformation properties of human tissue. So this one goes 20 minutes in, 10 minutes out, 20 minutes in, 10 minutes out, the whole time. And then that makes a huge difference. The adjustment, it's a trip because it takes me about 6 to 8 months to train a chiropractor to not torque the spine and to not twist it, and just to palpate when you're doing, like, say, a side posture, or the person's in the prone position or supine. You're literally going to feel those intrinsic muscles and the postural muscles radically change in tone. Radical. And then that means you've changed proprioception, so the entire biomechanics are different. Now, on our protocols at the office, since we do post x-rays at 2 weeks, okay, we'll get 30 adjustments in 2 weeks. And so that's adjusting a person every 2 hours, okay, at least 3 times a day. Now, 4 a day, some people can tolerate, but when we're doing the adjustment correctly, we're altering proprioception, but we're also causing a deep inflammatory response. So in between, since the body works on 90-minute cycles, we always say it's 2 hours, we have the person walking barefoot in the grass or hard sand. And that's vital, because once you've initiated those responses into the body, if the body is doing cross crawl work, you know, we're talking just walking barefoot in the grass or sand. Barefoot, well, for one, you get, you know, the antioxidant effect of that electronegative charge that's on the earth. That's cool. But barefoot, we're getting more sensory input. So since we've radically altered proprioception already, that barefoot walking is vital. And we also have, like, if the weather's inclement down here, which Southern California, you know, we have like 1 day of rain, you know, and it's never snows. So you might have to alter the protocols a little.
How about grounding mats and things?
The grounding mats are fantastic, and we'll recommend that for the sleep protocols.
Or like barefoot, like in the office, like during the bad weather.
Absolutely. That'll help. And if you could hook up, because we've got these vibration plates that are set at 30 cycles a second, and so that's gonna help that as well. And then we've got a couple of trampolines that'll help, but it's mainly cross crawl that's really going to get the big picture. Now, if you have any patients that, let's say they can't walk, okay, they got hip issues or knee issues or something like that, and then this also works with MS, Parkinson's, pretty much every upper motor neuron lesion you could imagine. We'll have them sit on a bench and put an ankle weight on. So this is going to open up the knee joint, which you're talking a massive amount of joint mechanoreceptors in there. And we'll have them just dangle the knee, okay, not lifting it up, because that can damage the knee joint if it's not stable. But we'll have them do this cross-crawl movement of the ankles to, again, stimulate proprioceptive responses. And then that's going to help with MS. It's going to help with a lot. But when you're talking like Parkinson's or strokes, we'll have them swing like this with the ankle weights. And for, you know, a very small frame, like 100 pounds or less human, we'll do 5 pound per leg. On, you know, 120 plus, you know, we'll do 10 pounds per leg. So it's pretty significant. But we'll also have a positive stop, where when they're dangling their legs, their toe will just tap like a chair or a wooden box that we have that they can kick. So that way they're getting the proprioception of that joint mechanoreceptors opening and closing. But then you get those Pacinian corpuscles, the pressure sensors, you know, tapping one side, then tapping the other side, then tapping the other one side, then the other side. And that has a massive change in how the brain works. Massive.
Excellent.
Oh, it's so much fun. Yeah, because you'll see, and this is the coolest thing is with like Parkinson's and upper motor neuron lesion people. I mean, it's the best way to regenerate cartilage in the knee, without a doubt. And if you check out our knee and foot health video, because looking at the x-rays that we got, you're talking that there's also going to be secondary injuries, knowing that these discs have been there for a while. There's going to be flattening of the feet, possible bunion formation. That's going to be altering the gait. It looks like there might be inflammation at the sacral iliac joint as well. And if there is, a trochanter support will be appropriate. One of the things that a lot of chiropractors get in trouble with is, they'll find a tender spot and push. Now, with 4 discs out of 6 in the low back that are malfunctioning, you got to know the sacral iliac joint is going to be unstable. And so a typical chiropractor on this, they'd be adjusting that sacrum. Here, why don't you come over here? I'll put it on for you. Because this way I can show as well. Because the typical chiropractor will adjust the pelvis, they'll feel better, and then it'll end up, by the time they get home, it'll hurt. So this thing here, yeah, so now top of the iliac crest there, this goes 1 inch below, and here. So trochanter support, you get them from Mayer Distributing, they're about $10. That's one, and the other 2 pull tight.
Hi.
Perfect.
Hi.
Thank you for demonstration.
Sure.
Yeah, and by the way, if you're curious, all girls in California look like that. Get over here. Okay, or look like this. I love you, dear.
Thanks for a great morning.
Okay, you guys going to the beach?
Yeah.
Okay, have fun. No
Bye.
no sunblock. Yep. Okay. Okay, so to stabilize that pelvis is going to be vital, but also when you look at our knee and foot health video, we detail out the importance of getting the calf to work correctly, because in long-term disc injuries like this, you're talking compromised nerve supply to the pelvis. So, rectal, prostate issues, all of that stuff are going to be secondary. So restoring a normal gait is going to be vital. So we'll give a block. Man, this is so helpful. I had to have these props here all the time. This is just a 4x4. Okay, cut about 5 7/8 long. Okay, the reason is because the saw blade takes up 1/8 of an inch, and I'm a cheap bastard.
Yeah.
So if I cut it 5 7/8 at a 12-foot length, I can get 24 of these. I don't think anybody has a foot wider than 6 inches.
Right.
Although I've told my wife this is 1 foot. And this one, the toe will be on the block, and the calf stretch. You'll see it on the videos, and that's held for 1 minute twice a day, because to stretch the calf and restore normal gait, that's going to be the key in stabilizing the pelvis. And knowing that the lumbar is dysfunctional, it's going to take a couple of weeks to do that, to start to restore normal function. But Doc, what are your protocols for post X-ray? Like, do you shoot post X-rays at 30 adjustments, 60 adjustments, or?
We do it probably somewhere around between 4 and 6 months.
4 and 6 months?
Yeah.
Okay, so you're doing the time?
Not as much. Depends on a lot of different things with the patient. How they responded. Like, it could be a number of visits, but I'm not as strict on routines. I'm more of an artistic approach, so I go more by feel. And so when I feel like it.
Okay.
But it works, so it's around, whatever their plan was. They say they do like a 4-month plan or a 6-month plan or a year plan. Sometimes we're not doing it for much later, and sometimes we're doing it a little earlier. So there's no real hard fast rule that I use.
Do you do any like a subluxation station where you're
Yeah.
doing heart rate variability and rolling thermo and surface electromyography?
Yes.
Oh, cool. Do you do that on a regular basis, or?
It's much more than I do the X-rays because because it's easier, it's faster, it's safer.
There, you got to check out CBP. They just did a new article on radiophobia. Okay, and you're going to see the data on X-rays are like amazing. There's such a hormesis effect, and a lot of the data that they're using on X-ray safety protocols were based on Hiroshima radiation and not X-ray radiation.
Excellent.
And check out CBP. It's called radiophobia.
All right.
Okay.
I'm probably more afraid of Wi-Fi than I am of X-ray right now.
Yeah. That's any type of consistent radiation. But man, on the stuff that we shoot, even the state says we can shoot 75 films of our largest film in a 30-day period per person. But they're using old data too.
Yeah, we use the highest speed film, the best cassettes. We're going into this year. We're finally getting the digital X-rays.
Oh, you're gonna have so much fun. Oh my gosh. Yeah. Just the processing, the ease, the no more negative environmental impact. And then for a marketing tool, and because people will say, wow, I really want to show my spouse this.
Yes.
We give everybody a CD copy of their X-rays. And so this way, if they can visualize what the problem is, and this goes in their report of findings paperwork, that they can go in there, pop it in there, and just view it. And then you can even email the X-rays so that they can post their pre and post X-rays on Facebook, and say, hey man, this is what my chiropractor's doing.
Yeah. Well, we do have them take, video, like pictures of them with their phone. So.
Cool. That's a start.
Yeah.
Yep. So now, do you guys have any questions?
No, that gives me a lot of different things that I can incorporate that will be very helpful. I mean, I love the whole proprioceptive change, the whole understanding of how that works, and because you got to change the pattern, the inertia of where it is to where it should be, and those tools are excellent. I appreciate this. Yeah,
the only different things that we do is we'll do a cervical challenge for sure. And, this is just having the person in the prone position, typically under abdominal suspension, if they have a really good, well-built abdomen like I do.
We can only see from here now.
Yeah,
okay. No, it's a man tummy. It's taken me years, okay? But on this, because it's going to put the spine in a slightly more lordotic position, and then we'll go in there and we'll apply pressure. Typically, we'll start from the anterior to posterior and check it and see how the legs level out. Then we'll do side or posterior. And by changing the pressure on that, the postural muscles change in tone, and that changes the leg length. And so that'll clue us into a C1 clearing, which is going to be vital, particularly in autonomic dysfunctions. But then we'll also do skull plates. Now, some of the skull techniques out there are a trip. If you're doing skull work on anyone, and the best skull guy in the world is Richard Turner in Toronto, and I've studied with him a couple of times. He does CATS, cranial adjusting Turner style. That's his thing. Yeah, he's a cool guy. But man, if you can get up to any of his classes while he's still teaching, because you'll have a whole new appreciation for skull plates. And when you're adjusting the vaccine damaged kids out there, which, everyone, you'll see right on the sagittal sutures, you'll see a giant hot spot in there. And you're actually going to be able to gauge the inflammation because the meninges literally invaginate up into those sutures. And so you'll see that the body has an increased heat one day, decreased heat the other day. So it's going to gauge the immune system responses. So just the average person, It's going to be rare to find, like in older people who only had like 10 vaccines. They might have some meningeal responses if they've had antibiotics or steroids or things like that. But all the kids are going to have messed up brains.
Yeah.
And so moving.
I actually adjust. It makes it audible. It is screen. We have two sacro-occipital specialist massage therapists that help do a lot of our cranial work for us.
Cool. Yeah, because we'll do facial adjustments. We'll do internal mouth adjusting to alleviate the pressure off the sinuses. And those are all secondary to again, change in proprioception, but it's also might be a missing component, particularly when you get people with abnormal cell growth, like cancers and things. Yeah, but cancers and things, they go away quick.
All right.
Okay.
I have a question. So how bad am I?
How bad are you?
Yeah, I mean.
Well, I got to tell you, there's no fusions. You've got degenerative changes consistent of trauma over 20 years ago. You move excellent, but you've got pelvic instability. 4 out of the 6 discs in the low back aren't working right. Okay, so that's a big deal. To figure 72% of your discs in the low back are dysfunctional. You've got an unstable pelvis, but you seem like a very pleasant person.
That going for it.
Yeah, you're going to be fine. Okay, but also do all the other protocols. Okay, because there's 3 stressors that you got to fix: physical, chemical, and emotional. Yeah, Dr. Keegan's going to knock out the physical. Okay, I'd recommend initiating protocols that you're comfortable with, because we get patients from literally every corner of the world, and we have to have strict protocols because people will be here for between 2 and 4 weeks. And in 2 weeks, we're doing post x-rays because we'll get 30 adjustments in 2 weeks, and we'll show pretty decent changes. But during that process, sleep aspects, so doing the circadian rhythms, resetting the sleep, and that's journaling, reading before bed, wearing nightshades because the eyes open up every 90 minutes, going to bed at 10 to 10:30, resetting and getting out by 4 to 4:30 in the morning for about 21 days. And Doc, we got a bunch of videos on sleep protocols, because we'll do the exam and x-rays on one visit. We'll do the report of findings on another visit. We'll adjust, for, 4, 5, 6 adjustments. And then we'll give them what's called a nutrition report, where we talk about like basic stuff, no GMOs, plant-based diet. And then we'll do variations, like if there's inflammatory bowel or digestive issues, they're going to be doing juicing and blending to start to clean the arteries. Plus, one of the things that's nice, on the lateral lumbar, we'll typically see atherosclerosis or hardening of the artery of the descending aorta. Then we know, man, they got to do at least 1 quart to 2 quarts of juicing a day to get those soluble fibers to clean the arteries. And then we'll suggest basic supplements, and we're talking, they got to be in whole food form, because if a person's in a sympathetic dominant state, they're not producing enough stomach acid, so they can't break down the pills. So, and this is really severe. I don't know how severe he is, but, this is really severe cases. It's whole food supplements only. And then the sleep protocol, the nutrition protocol, and then we do neurolinguistic programming, where we talk about the I am exercises. And this is where they have to do 10 minutes 3 times a day to reprogram their neuronal firings. So addressing the physical, chemical, and emotional stressors, it's fantastic.
Yeah,
and
I
then,
just do the physical, and I tell them they're up to, I do a very cursory, like you're responsible for the chemical and the mental, and so I say, I'll take care of help you with the physical, and then you have to worry about what put more God's food, less of man's, and then the mental, you got two, whatever, one channel to watch at a time, in your mind. Make sure you're putting the right thing in that on that screen. But going through it and giving them the idea, like the 10 minutes 3 times a day of the neurolinguistic stuff, is That's something I can start, looking into.
Oh, buddy, it's fantastic. And you'll see we got videos on reprogramming the brain. And it literally, I make all my doctors, I got 5 docs working for me, and they all have to do it
Yeah.
before they get on the floor.
It's coming from there down, right?
Absolutely. And then you figure the way we describe it, and this is the script for it too, is emotions are chemicals secreted by how the brain perceives the environment. So, and I'll use a picture of a puppy like this. And I'll say, if I show you a picture of a puppy and you thought that dog is going to chew my shoes and crap on the carpet, your brain's going to secrete adrenaline and cortisol. That's going to decrease how your body regenerates tissue. If I show you the same picture and you thought, oh my God, that's my best friend, your brain's secreting dopamine and serotonin, and immune system is going to be stimulated. So it's not based on the stimulus. I'm just showing you the same picture. It's based on the past programming of your mind on the emotional state that you're going to be presented with. And 100% of people with a chronic illness or injury are going to be in a certain emotional state. And I send them a sheet that has words on the bottom or words on the top. And this is a trip about being human. Okay, now I'm talking everybody with a chronic illness or injury has the same exact self-talk words. And I'm talking the patients from Dubai, Saudi Arabia, South Africa, Australia, the Philippines, India, Japan, Russia, all the patients from all around the world, because I mean, literally every frigging corner of the world, we have the same self-talk. Because I've got 3 more consults today, and 2 of them are in 2 different parts of Australia, and one's in Europe. Okay, so, and they all have the same self-talk words. That blew me away. Yeah. Where, because we're under that same emotional status. So now when they realize that they're going through that emotional state where, one neuron fires than the other, it's like, holy shit, I have trouble peeing. That means I've got my prostate swollen up. That means I'm going to have erectile dysfunction. That means, holy shit, and all he's doing is urinating. So when they realize this neurons that are firing off to generate that emotional response, then they pull out immediately. And then they do that neuro-linguistic programming, which involves body posture, volume, intonation, and breathing. And then they can reset that emotional status. And when they've done that enough times, so it's an aggressive approach. And also too, at the report of findings, when you get great post x-ray changes, and let's say there's one that's not being changed, like the lateral lumbar or something, are you doing the foam block when you're sitting? Oh, gee, doc, I forgot about it. Well, are you changing your gait? Oh, I forgot about this. Are you doing the neuro-linguistic programming? I started, but it just, I didn't. So this way, you give them specific actions that they do with for their responsibility, and the results are I found way better.
I like it very much.
So now, any questions?
No. Thanks for talking to me yesterday.
About
my son, but it didn't help.
Oh shit!
Yeah.
Isn't that nuts?
Got done talking about it. It's pretty ugly what they're gonna do. They're gonna cut out his whole rectum, and then they're gonna take a piece of his lower intestine and take it down, sew it onto the rectum, put a temporary bag on for 6 weeks or so, and then they're gonna say that he's gonna have 10 to 12 bowel movements a day. I don't know if it'll be controlled. I don't know if the rectum muscles are going to actually work, but they told him if he didn't get this done, he was going to die.
Yeah.
I mean, that's a horrible thing to tell him. And they said, or if you don't die, the cancer is going to come back really fast. I'm like, it's not even there now. I told them from the day one, it's finally gone. And they said, no, it'll come back if you don't do this.
Yeah, that's the same thing. When I met my wife, she had ulcerative colitis for 10 years. And so that's 10 years of steroids and antibiotics and pain relievers. And they said, if you stop these drugs, you're going to die.
Yeah.
It took me 1 month to get her bowels working correctly, and she stopped the drugs immediately. Wow. The worst case in this, there's nothing that you can do. And the most frustrating thing in the world is when your belief system is that the body can help itself and their therapies are toxic. I had this one patient who had breast cancer. diagnosed, biopsy, everything else. She wanted to treat it naturally because she had a sister that was killed by chemotherapy. So we go in, I think it was like 4 months, x-rays clear, autonomic nervous system cleared. She went back in, totally cleared, no sign of breast cancer at all, no lump, nothing, it's all gone. And her husband still didn't like because the oncologist says, it's undetected, but it's still there.
Right.
Okay, show me, you're pulling this information out of your ass. And so they said there's an experimental chemotherapy drug that she signed up for that she's going to take. And it's like, wait a second, you don't have breast cancer. How could you take this? Well, my husband wants me to do it just to make sure.
Wow.
And the only data points that she could give are the negatives. I mean, none of this stuff makes sense.
Right.
But, just throw love out there. Knowing that he's rectal cancer, get him over to the doc. Okay, Dr. Keegan is, he's going to have lumbar issues. He's going to have an unstable pelvis. He's going to have sleep issues. He's going to have poor gut flora. He's going to have everything going on. We get the physical working better so that it can prevent it and strengthen his immune system, and he'll never have a recurrence of this. But changing his belief system is the hardest thing ever.
Isn't it Dr. Keegan?
It's okay. It's right here. It says,
It
but,
says Keegan.
Doc, my name is Festa, though. Ron Festa. Keegan
Oh,
is our,
cool.
and she set this up so it says Keegan up here. But,
Yeah, I was like, who's
But
Dr.
that's-
Keegan?
Okay.
Okay, I see. All right.
Okay. Okay. Now, any other questions, gentlemen?
No, road to recovery now.
Oh, yeah, absolutely. Well, luckily, health is your natural state. And
Right.
identifying 4 discs in the low back, man, yeah, you're going to recover easy.
Great. That's
Yeah,
good.
just slap a trochanter support and do those corrective exercises and keep going along with the sleep and protocols, the nutrition protocols, and the neurolinguistic programming. And share everything with Dr. Fester. I sent him handouts and everything. So
Okay.
this way, if you want to initiate the neurolinguistic programming, use my stuff. It's free. It's only meant to save people.
very nice. Thank you.
We got to. I want to just healthy, not sick people, except, that's not our planet right now.
Right. We have a big job.
Yeah.
All right, well, we're gonna put this. My son's the other one on there, the one with the hair. I don't know if you can use
Yep.
it.
Yep.
Yeah, he has all my hair, so but he's gonna put it on you.
Well, he probably had a very not a pretty skull, because they say God covered the imperfect skulls with hair.
Okay, there you go.
Yeah, I'm one of those imperfect skull guys.
All right, great.
Okay, gentlemen, you have a fantastic weekend.
You too.
All right, thanks, Doc.
All right.
Okay.
Appreciate it.